Hari Om. We will talk about yoga for weight loss. So, as we all know, there are various effects of yoga, various advantages of practicing yoga. One of the advantage of practicing yoga is to attain a desirable weight loss. So, in short, we will try to understand what is weight gain, what is obesity, and then we will try to understand how yogic practices help for losing that extra fats, extra adipose tissue. Now, obesity as such is abnormal excessive growth of adipose tissue. Adipose tissue is the fats in our body. So, either the number of fat cells they can increase in our body, or the number of fat cells they may not increase, but the fat cells they will remain the same number, but there can be increase in the size of each fat cell. So either the adipose tissue cells they accumulate more fats, or the number of adipose tissue cells they increase in our body, which can lead to obesity. Now classically two types of obesities have been mentioned. One is the android obesity, or it is called as the abdominal obesity, where mostly the fats it accumulates over the abdominal area. And the second type is the gynoid type of obesity, where the fats they accumulate more on the gluteal area, the seat, the buttocks, the thighs. That's called as the gynoid type of obesity. But then these are two classical types of obesities. But as such, what we observe is a generalized obesity is mostly commonly seen in many individuals. Now, obesity is usually measured in the terms of BMI, body mass index. So, a normal BMI is considered to be between 18.5 to 20. And someone having a body mass index of more than 25 is considered as overweight, and someone who is having a body mass index of more than 30 is considered as a obese person. But again, to repeat, the normal body mass index for an individual, it should be between 18.5 to 20. Now, what are the risk factors? What are the factors which can lead to obesity? Or there is no single cause, there is no single factor which can cause obesity. So there are multiple factors which can lead to obesity. So they are called as risk factors. One of the most important risk factor is the age itself. Now it's an observational study that men between the age of 29 to 35 years, they have a tendency to gain more weight. Reasons unknown. It's just an observational study. And then women between the age of 45 to 49 years, they have the tendency to gain more weight. Now to this, we can add one more type of obesity is the infant obesity, and maybe one more is the childhood obesity. Infant obesity is in a newborn up to the age of 6 months. Now, this is commonly found in those newborns who are given unnecessary supplementation of food. Apart from mother's milk, whenever it is necessary, the infant can receive nutritional supplements. But whenever it is unnecessary, if the infant is given supplementary food, then it can lead to obesity in an infant at a very early age before the age of 6 months. That's called as infant obesity. And childhood obesity, again, it's very common. It's because of the habits of the children, the eating habits, and the sedentary lifestyle, like more sitting at one place and no games, no sports, no physical activity, that can lead to childhood obesity. Junk food, fast food, that can lead to obesity in early childhood, and it would be continued. The habits, if continued, the obesity would also be further continued in adulthood. So infant obesity and childhood obesity, they are becoming quite common nowadays. The next risk factor is the familial tendencies. Now, usually the habits of the family, they are common. Eating habits, the lifestyle, the behavioral pattern. So usually it is seen that obesity, it runs in families. That's because they eat the same food, they have the same habits of exercising, they have the same habits of sleeping, they have the same habits of physical activity. So this family tendencies, when it comes to the treatment of obesity, it needs to be changed. A lifestyle change. Only yogic practices would not be helpful. The lifestyle also needs to be changed if the person has to lose weight. Then physical inactivity is one of the major reasons for obesity. Modern life, maybe it is stressful, but at a physical level, our activity is reducing. We have machinery available for everything. Our household work, the machines can do it for us. Work has become simple. Physical work, it has become simple. There are gadgets, there are machines which can help you to simplify your life. But then this has reduced the physical activity in our day-to-day life. And reduction in the physical activity of our day-to-day life, it causes obesity. And this obesity, it further reduces our physical activity. So it's like a vicious cycle. Less physical activity causes obesity, and the obesity further reduces our physical activity. And this vicious cycle, it goes on continuing, and the person keeps on gaining weight. Then, of course, eating habits, the major role in weight gain, the major role for obesity is the eating habits. Preference to sweets is one of the major reasons, no doubt about it. Then, preference to refined food and more of fats, it can lead to obesity. But then it's also important that we have a proper periodicity of consuming the food. We should eat food at a proper time. Usually in our lifestyle, we keep changing the timing of consuming food. We keep changing the time of having our lunch depending on how important our meetings are, on how important our work in the office. So importance is given to work, and the time of lunch maybe is changed every day. So if you do not have fixed timings of food, then it can be one of the reasons, one of the risk factors which can lead to obesity. Because where there is no assurance of a continuous supply of energy, the body will start accumulating energy. So when there is no assurance, there is accumulation. And this accumulation of energy will be in the form of fats, excessive amount of fats. So it's important that we have specific timing for consuming food. Then unnecessary munching in between the meals is again a risk factor for obesity. There is no reason, but then still we keep eating in between the meals. That can lead to obesity. It's unnecessary consumption of calories. Sometimes we stimulate the metabolism with empty calories, or even sometimes we stimulate the metabolisms with some drinks in between. Consumption of maybe tea or coffee unnecessarily can stimulate the metabolic processes, and then it can lead to obesity. So just eating unnecessarily, or even sometimes I call it as social eating, unnecessary eating, it can lead to obesity. Then there are psychosocial factors. The word is very important. Psychological factors and social factors together. Psychosocial factors. So it can be any kind of emotional disturbances. It can be stress, anxiety, depression. You can go on adding to the list. So most important role is of the psychosocial factors. And again, when it comes to the treatment part of it, these psychosocial factors are also to be considered when we try to manage obesity with yogic practices. We can't just say that, okay, practice sun salutations and it will help you to burn calories and you will lose weight. If there is some stress factor behind that stress gain, we have to manage that stress factor also. So it's important that we take into consideration the psychological factors when we are treating and we are managing the weight of a particular person with yogic practices. And then in the end, there are endocrine causes, hormonal imbalances. There are many hormonal imbalances, so we will not name them here. So hormonal imbalances is one of the reasons for obesity, and last is drug induced. Drug is medicines. Some medicines, when taken for a long duration, as a side effect, can produce obesity, especially some hormonal pills. Taken for a long duration of time, maybe they can produce as a side effect excessive weight gain. So in short, these were all the risk factors, the major risk factors which can lead to weight gain, which can lead to obesity. Now, actually, whatever energy we get through our food, it is utilized, it is spent every day, and it is used for some basic things like the heart, lungs, intestines, kidneys working, which is called as the resting basal metabolic rate. Also, we need energy to convert food in our liver. And this energy utilization, it can be affected by our physical activity, by our environmental adaptation, and many more things. But it's important to note that the average daily expenditure, the average daily requirement of energy in obese people is more than other people. So their resting BMR will be more. They will consume more energy for the conversion of food, so on and so forth. So the average daily requirement of energy in obese people is much more than other people. Now, usually in a healthy individual, when they start losing weight, the appetite is increased and the energy consumption is reduced so that the weight loss is stopped. On the other hand, when there is a weight gain, naturally the appetite is decreased and the energy consumption, the energy utilization by the body is increased so that the abnormal weight gain is stopped. Now, these are the natural balancing processes in our body, and the body is aware of that. But usually, these two processes they fail because of abundant food available and less physical activity. So this appetite increase or decrease mechanism or the energy consumption increase or decrease mechanism, the body cannot follow it to maintain weight because food is available in abundance and our physical activity has reduced. So when this balancing mechanism goes out of balance, then it can cause obesity. Also, there is an appetite center, hunger center in our brain, which is stimulated, which is controlled by multiple factors. Like psychological factors can have a control on the appetite center. For example, when we are stressed, sometimes we don't feel hungry. That's because the appetite center can be influenced by stress. It can be influenced by BSL, blood sugar levels. So the blood sugar level can also increase or reduce the hunger. Even insulin, the hormone which is related with diabetes, it can have an influence over the appetite center. And cultural factors, the way we are brought up. Different cultures have different eating habits. So that factors also have a control over the appetite center. Now, when the control over the appetite center is a bit disturbed, then people would have a tendency to overeat and then there would be weight gain. So again, I am mentioning that it's not only a physical level that you just burn the adipose tissue, you just burn the fats and you will lose weight. It's not that simple. You have to work at a psychological level, you have to work at the neurological level, you have to work at the hormonal level. It's just not a physical activity to burn the fats, to utilize the fats, to utilize the adipose tissue and then get weight loss. That's not possible. Now, quickly, we will understand how the assessment of obesity is done. Now, there are many complex mechanisms. Nowadays, we have modern technology available which can actually tell you the total amount of fats in your body, the total amount of percentage of fats in your body, percentage of water in your body, so on and so forth. But a quick over the table formula for assessment of obesity is the BMI, body mass index, which is accepted world over. And initially we mentioned that the normal body mass index is between 18.5 to 23. So to know your BMI, body mass index, you need to know two things: your weight in kilograms, and it is to be divided by the square of your height, and the height here is measured in meters. So just find out what's your weight in kilograms, find out what's your height in meters, put it here in the formula, and you can get your BMI, body mass index. So it should be between 18.5 to 23. If it is between 23 to 25, it is considered as borderline. It's not alarming as such, but then you should consider that you have started losing, started gaining weight. And if it is above 25, then definitely you need to lose weight. You need to control your diet. You need to maybe take some exercise and try and reduce the weight. So that's body mass index. Then there are other formulas, or I would say there were other formulas like Broca's index and Lorentz formula, but nowadays they are not in use. Here you can just see them for your information. The next thing to assess obesity or to assess how much fats you have in your body is the skin fold thickness. So there is a specialized instrument which can actually measure the thickness of our skin, and from that it is estimated how much fats is there in your body. Or the other way is waist hip ratio. Take a measuring tape and then measure your waist and measure your hip, and the ratio of your waist to hip in men, if it is more than 1, it is considered as obesity, and if it is more than 0.85 in women, it is considered as obesity. So another one simple way just to assess if you are having excess fats, measure your waist and hip, get a ratio done of that. And then, as I said earlier, you can have the total body density or the total percentage of fats in your body or the total percentage of water in your body. Precisely, you can measure it, but then it is more time consuming. So then the best thing what we stick to is the body mass index, BMI. So quickly, the complications of obesity: overweight. It can lead to problems with the liver leading to gallstones. It can lead to arthritis, joint pain because of the excessive weight. Infections are quite common in obese people. It can lead to diabetes. It can lead to high blood pressure. It can lead to coronary heart diseases. It can lead to breathing problems. And all these things, obviously, it will lower the life expectancy of people who are really obese. Now, talking about yoga for obesity. So, as I said earlier, it is not only about the physical level that you practice some physical exercise, you practice some physical postures, and then you lose weight, you lose fats, and then it's done. That's not possible. So, the first and the most important thing is motivation. For weight loss, a long duration lifestyle change is very, very necessary. It's not a short-term goal that within a very short period you lose weight and then that weight it remains in a normal range. You have to follow those lifestyle changes for a bit longer duration of time. And the most important lifestyle changes would be change in diet and increased physical activity. So this increased physical activity, it includes your day-to-day activities and includes exercises. We will talk about 3 days of planned diet. Now, this diet is suggested for weight loss, and you can even practice it for a better function of your digestive system. Or even a healthy person can practice this diet plan just to keep himself healthy. The only important thing is that this diet plan is not recommended during pregnancy. So pregnant women should not be practicing this diet plan, and children should not practice this diet plan. If someone is diabetic, having diabetes, then if there is a possibility that you can monitor the sugar levels very well, you can measure the sugar levels very well, then it can be practiced. But then, if you are not able to measure the sugar levels at home, then it is preferred that a person suffering from diabetes does not practice this 3 days of diet plan. Now, for weight loss, you can practice this once in 15 days and keep practicing till the desired weight loss is gained. So there is no time limit that how long, how many months, how many years you will be practicing it. Or, as I said, a healthy individual can also practice it just to keep himself healthy. So, let us try to understand these 3 days of diet. Day one includes raw food. It means that on day one, you can eat raw fruits and vegetables. But as we are planning it for weight loss, you cannot eat grapes, mangoes, and bananas. These are high calorie fruits, sugary fruits. So mango, banana, and grapes are not to be consumed on day one. Other fruits you can consume. You can eat green leafy vegetables. You can eat any other vegetable which you can eat raw. However, you should not be eating dry fruits. You should not be eating pulses. You should not be eating any kind of nuts or seeds. So only fruits except mango, banana and grapes, green leafy vegetables. Even you can eat salads, but the salads are to be plain salads, no dressings, no olive oil added over the salad, no cream added to the salad. So plain salads can be consumed. And when you are eating these fruits and vegetables, don't add salt or pepper to these fruits or vegetables. They are to be consumed with their natural taste. Now you have to eat it sitting at one place at specific timings. So maybe you can eat it 3 times a day or maybe 4 times a day. But sit at one place and eat as much as you want, as much as you can. However, don't go on eating the fruits or vegetables throughout the day. It's not that you ate one apple and within half an hour you are feeling hungry, so you eat one orange, and then again within an hour you are feeling hungry, so you are eating cucumber. That's not what we are aiming at. You can decide that you will be eating 3 times, maybe 4 times, then sit at one place, eat as much as you want, and then stop eating. Don't go on eating every half hour, every 1 hour. So day one, as we explained, it would be just fruits and vegetables. Day two is lime water, warm lime water. If lime is not available, you can have lemon water, lime or lemon water. How much lemon, how much lime to be squeezed in the water? There is no specific calculation for that. It depends on each one's taste. So some would prefer more sour water. Some people would prefer less sour water, less sourness of water. It depends on your taste. But day two, it's going to be only lime water throughout the day. It's going to be warm water, no sugar added to it, no natural sweetness added to it, no honey added to it, no sweet added to it. You can drink as much water as you want. Whenever you feel thirsty, you can drink this water. Whenever you feel hungry, you can drink this water. In between, if you feel like, you can even drink plain water, because many a times this lime water, lemon water, it brings sourness to the mouth. So you feel like drinking simple water. So definitely you can drink simple water in between, but then that simple water also should be warm. You can drink as much glasses as you want. You are not going to eat anything. No fruits, no vegetables, no lunch, no dinner, nothing. No eating at all. That's day two. On day three, you will start on drinking juices, fresh fruit juices, even fresh vegetable juices can be consumed. But as said earlier, juices of grapes, mango, and banana are definitely to be avoided. Other fruit juices, you can drink them, vegetable juices, you can drink them. But these juices, they should be fresh juices. It should not have ice in it, and no sweeteners, no sugar is to be added to the juice. So natural fruit juices, natural vegetable juices. As a guideline, you may require to drink a glass of juice every 2 hours. As I said, it's a guideline, it's not a rule. Some people may need to drink it after, say, 3 hours. Some people may feel like drinking it maybe within 1.5 hours. So there is no rule for it, but then just a guideline that if you have a glass of juice every 2 hours, it gives you enough nourishment for the day. So throughout the day, you're going to have a glass of juice every 2 hours. And by evening, you can have some vegetable soup, some, say for example, tomato soup. So you can have, by evening dinner time, you can have tomato soup. It should be plain, you don't add any cream or anything to that. Or the Indian khichdi, dal mixed with rice, you can have it in the evening. So in short, this is the 3 days of planned diet. One thing to remember, during these 3 days, if you are uncomfortable, if you feel that you cannot continue with this diet plan, you can stop the diet plan at any time, drink a glass of juice, maybe in a couple of hours have some soup, and then start with your regular meals, regular diet. So it is not compulsory that you continue this diet for 3 days. If you feel uncomfortable, you can stop in between. Now, during these 3 days, it's a low calorie diet. So your body is going to use the fats, your body is going to use the adipose tissue for energy production, and you are going to lose weight. So as it's a low calorie diet, as it's a food with very less calories, you're going to get the benefit of losing weight. But at the same time, it's going to help you to clean your digestive system. Because on day one, you have lots of fibers entering in your digestive system. Because fruits and vegetables, they are having more fibers. So these fibers, they enter into the digestive system. They work like a natural brush. And on the second day, you add lime water or lemon water. And this lemon water, it helps to clean the digestive system. So the fiber and the lemon water, both of them, they help in cleaning the digestive system. So first 2 days, we can say they are cleaning. And on day three, we take juices. Just because for the first 2 days, we have low calorie intake in our body. The second day is only lemon water. So we have very less calories entering into our body. So on the third day, we need energy. And we need that energy instantly. We want to nourish our body quickly. We don't want to waste time in digestion and absorption. So juices, they're digested quickly, absorbed quickly, and your body gets nourishment very quickly. Now, because of these 3 days of planned diet, because of this cleaning of your digestive system, your metabolism is balanced. It comes back to normal. And when the metabolism is balanced, when the metabolism is brought back to normal, it has a very long-term, very long duration effects for keeping your cells healthy and of course in weight management. So these 3 days of planned diet would be beneficial for improvement in your metabolism and also for your weight loss or weight management, we would say. And then of course your metabolism is brought back to normal, so also your digestive system is getting a cleanse because of the fibers and the lemon water. So this is in short the significance of the 3 days of planned fasting. The yogic practices, the first and the most important thing is yoga nidra. So if there is some psychological factor for this weight gain, it will be handled with the practice of yoga nidra. So reducing your stress and tension, normalizing your metabolism, and most importantly, to motivate yourselves to continue with the practice of the dietary changes and the physical activity changes, this Yoga Nidra practice would be very, very important. So it's not that only you have to increase your physical activity, some kind of relaxation is also necessary to reduce the stress levels of your body and mind to bring back the metabolism back to normal. Now, next recommendation, the ideal recommendations we are talking of, it's not that on day one you will start with all these things. But then the ideal recommendations is 32 sun salutations in 8 minutes. But then you have to build up the practice slowly. Maybe you just start with 2 or 3 sun salutations. After 5 days or maybe after 7 days, you increase them to maybe 5 or 6. And then again after 7 days, slowly you go on increasing the number of sun salutations and slowly you go on increasing the speed of practice. So that ultimately you reach a level of practicing 32 sun salutations in 8 minutes. Again, I repeat, it is not to be done on day one. Slowly you have to build up the practice. Then the next recommendation is for the yoga postures, yogasana. So specifically for balancing your endocrine system, balancing your metabolism, the asana practice which would be recommended would be the Vipareetakarani, Sarvangasana and the Matsyasana. Inverted posture, shoulder stand and fish pose. Now these are the main asana what we are talking of. So these three main asana, they will help us to stimulate the metabolism by balancing the endocrine system, by balancing the hormones. Specifically here, the thyroid hormones, because thyroid hormones, they are one of the main hormones which control the metabolism in our body. Then for the abdominal fats, to reduce the fats from the abdominal area, to focus on the abdominal area, it can be Ardha Matsyendrasana, the half spinal twist, the Paschimottanasana, the forward bend, Bhujangasana, the cobra pose, Dhanurasana, the bow pose, and Shalabhasana, the locust pose. Now these asanas, instead of maintaining it for a long duration of time, the recommendation would be you can have repetition of these asanas. Maybe you practice this asana for 2 times, maybe 3 times, and hold it for short duration each time. So you practice the asana as a repetition of the posture, hold it for a short duration of time. It would be like a dynamic practice of yoga, which will help you to burn the calories, which will help you to utilize the calories more. For weight loss program, it will be a combination of classical yogic postures, but at the same time, you can have the dynamic yogic postures. To utilize the fats, to utilize the calories. Then the postures for reducing fats over the thighs is the Ushtrasana, then the Supta vajrasan, Uttana Padasana, Virasana, Trikonasana, Garudasana, Ugrasana, and Virabhadrasana. Now again, these postures, they can be practiced as repetition. The same asana to be repeated maybe 2 times, maybe 3 times. Hold it for short duration, hold it for a few breaths, and then release. So more than an asana practice, it becomes a movement. You get into the posture, hold it for a few breaths, and then release the posture. And then again repeat it. Now, all these asana, it is not to be started on day one. As I mentioned for the sun salutation, slowly you have to build up the practice so that all these asana practices, the pranayam which we are going to mention, the asana practice and the sun salutation is completed in around 90 minutes in a day. Specific pranayam which are recommended for weight loss, they are the Suryabhedan pranayam or the right nostril breathing and the Bhastrika pranayam or the bellows breath. Initially, you can start with a few repetitions, but then you can practice these two pranayam, both of them pranayam, maybe 5 minutes each for every day. But then it will take a long time to build up your practice. To practice this pranayam 5 minutes, you can slowly start with a few repetitions and then slowly go on increasing them. Same thing with the cleansing methods. Agnisara practice is recommended on a daily basis 100 times, 100 strokes of Agnisar, and Kapalabhati around 500 to 600 times. So you can take breaks in between, but then it is to be around 500 to 600 rounds. But then again, you have to slowly go on building up this practice. It is not expected that you have this Agnisar 100 strokes on day one. Slowly build up the practice and you can reach these ideal levels what have been mentioned. And then of course the practice of Uddiyana Bandha. Uddiyana Bandha will also help you to normalize your metabolism and to reduce the fats on your stomach, on your abdomen. Then Laghu Prakshalan, the short cleanse with the practice of the 6 yoga postures and drinking 2 glasses of waters. So the Laghu Prakshalan can also be recommended, but then depending on the other situations, there would be the recommendations for Laghu Prakshalan. So dietary changes, relaxation, and increased physical activity with the yogic practices can be helpful for weight loss, to burn the excessive fats, to utilize the excessive fats in the body. But it's very important that this is not within few days. It's a long duration process and the changes in the lifestyle, they are long duration changes. It's not that you practice yoga for a few days, expect the results, and once you get the results, you stop the practice. Yogasan practice should be included as a daily routine in your life. Because the practice of yogasan, the aim of practicing yogasan was not weight gain or weight loss. Practice of yoga is a part of life. Practice of yoga is to bring back balance in the life. And that's how yoga helps in weight loss. Yoga can even help in weight gain. It's a balancing mechanism. Yoga brings balance in the life. So the main aim of yogasan practice, yogic practices is not weight gain or weight loss. It is balancing in your life. This weight gain, weight loss, or the other effects of yoga, we would say they're just the advantages, more additional advantages of practicing yoga. So definitely yoga postures, practice of pranayam, practice of cleansing methods, practice of relaxation, it would help in proper weight management whenever necessary. Hari Om.